come as a visitor, not as a spy. Zambian proverb.
Even when I go back today, everybody still knows my name. When I go back, I usually have to, drop off the bus on the roadside and go 12 kilometers on the back of someone's bike. And so when I'm sitting on the back of someone's bike, it's not very often that a white woman goes through a village on the back of someone's bike. And so you'll just hear this going through the village. Is that Eliza? Because they said Eliza for Elizabeth. Is that Eliza? Oh, that's Eliza. And people start running, Eliza, like out of the village.
Eliza is better known as Beth Jere, who is cheered in her old Zambian village and surrounding areas for good reason. Though she was the first American her village ever met, she stayed on, helping locally at first, then regionally, and helping to save lives wherever she went. I'm Christopher Wurst, and this is
Soft Power.
Powerful.
Soft
Power.
Powerful stories.
Powerful.
Soft
Powerful. Stories.
I grew up in a small suburban town in New Jersey called Berkeley Heights. It's a small suburb about 30 miles from New York City. I had a very stereotypical all-American family. 2 parents, 2 kids, a dog named Midnight, a cat named Spooky. I went to public school. I was a member of National Honor Society. I was a varsity swimmer. I worked as a lifeguard at the local pool. I taught swimming lessons to all the kids in town. My family went to church every single Sunday without fail. I was one of those kids who saved their coins for Heifer International to buy cows and goats for children around the world, where you'd have that little photocopy of a cow in Sunday school that you'd color in with crayons every week to show how much money you donated towards a cow. I don't think any of us could imagine why owning a cow was important when we were little, but that's what they told us at church. And of course, growing up in New Jersey, every June we vacationed at the Jersey Shore, as we do. I think what set our household apart and my childhood apart from perhaps my classmates was that my family went out of their way to find cross-cultural experiences for my brother and for myself. For example, in grade school, a Japanese family moved to town, and we had to invite them over to play. It was not an option. They were going to be our friends. And I remember going to their house in my town and eating seaweed as a snack and being surprised that they didn't own beds. They slept on mats. And it was those kinds of experiences that my mother would seek out and force us to have these cultural experiences without leaving our hometown. My mother had been a Peace Corps volunteer years before I was born, and she started hosting a returned Peace Corps volunteer happy hour at our house for people in northern New Jersey who had been volunteers. And so, we were little kids, but the rule was that if I was in my pajamas and my teeth were brushed, then I could stay up late and I could open the door as people arrived at home, and I could stay up past my bedtime and see presentations from the volunteers. And so I'd sit there in the dark on the floor in my pajamas, and I'd listen to people talk about these adventures that they had and showing pictures of jungles and huts and muddy rivers. And I can still actually picture some of those pictures in my head. And I didn't know one country from another. I'm just sitting in New Jersey. But I definitely knew that there was adventures. I wasn't sure what I wanted to be, but I knew I wanted to explore. After I finished university, I didn't want to go into some 9-to-5 job. So I joined the Peace Corps, and the U.S. government sent me to Zambia, which is a landlocked country of about 18 million people in southern Africa. And I had no idea where that was. I had to look on the map. I was posted to a very small rural village. I lived in a mud hut. I carried water from the well on my head. The headman of the village adopted me as his official daughter. And I was the first American who ever lived there. So everybody knew my name. I think Americans we can appreciate our privacy when we lose it, when everybody knows your business. But it's great. As you can see, I'm a bit outgoing and social. So I took on all the questions people had, like, what do the Great Lakes look like? And do the used clothes in the market come from dead people in America? And what is the staple food that everyone eats in America? And why am I 22 and not married? My posting was in community health. The area around my village had about 35,000 people, and it had one health clinic, which was staffed by 3 people. And so I spent my 2 years of Peace Corps with my bicycle, provided by the U.S. government, riding through the villages to meet with different community health committees. And these health committees were basically giving health education in their communities, talking about why people should go get their children vaccinated, or how to avoid getting malaria, or why it's important to drink clean water and not the water from the village. You know, when you're sitting there in the community, you know, you realize how much it's against people. You know, you don't have clean water and there are mosquitoes, and you don't have a very diverse diet and choices of what to feed your kids. You know, you have to make choices with very limited money and very limited resources available in the community. And you start realizing that, you know, it's tricky. Good health is hard. For me, a light bulb moment really was that near the end of my second year, 10% of the adults in my village died of AIDS. And, you know, this is where I get choked up, because they were my neighbors, they were my friends, and they just got sick. And there was no medicine, you know. The clinic staff had no HIV tests. There was no HIV treatment in the country. People weren't trained to provide HIV medicine. But HIV treatment was widely available in the U.S. And, you know, I'm sitting in my village with people who have made sure that I ate every day. They greeted me every morning. They were my social circle for 2 years, and they had a death sentence. And so, you know, you would see, you know, someone would die, and then the children that I knew would be sent away to stay with relatives somewhere else. And one day, you know, orphan children would show up to stay with grandmothers in my village. One day there was a new little girl named Sarah, and she was so sweet, and she used to hang out at my house. And I remember asking her, like, where did you come from? She just showed up. She taught me the word to die, because I actually didn't know that word in that dialect. I knew it in a different dialect. But now she and her baby brother were living with the grandmother in my village, and she was never sent to school. And we used to sit and I'd teach her how to spell her name in the dirt. But I feel like at that point, I was a witness to something that was happening on a very large scale. Americans were living with HIV and Zambians were dying with HIV. And it was all just based on drugs, medicine. You either have it or you don't. And so you can't walk away from it. You can't forget that. I think that's where the real drive came from, to make my career in public health, to be part of the solution, so that you didn't have this inequity, because it's the right thing to do. Fast forward after Peace Corps, I ended up getting a Master of Public Health degree in the U.S. And right as I graduated in 2004 is when President Bush started PEPFAR, which was dedicating American foreign aid to bringing HIV treatment around the world, including to Zambia. And that kind of guided my career for the next 15 years. I worked for several American non-governmental organizations and worked on HIV prevention, treatment, and community programs focused on Kenya, Zambia, and Tanzania. You know, when I say this, and people who are outside the sector, I think it's important to emphasize that starting HIV treatment programs is not Americans standing around handing out medicines. It's basically setting up an entire clinical program at an existing hospital, which is run by the country, you know, Kenya or Zambia or Tanzania, and staffed by citizens of that country. So the doctors, the nurses, like, they're from that country. And a lot of times in my career, I was usually one of the only Americans that was working on these projects. My first non-governmental organization job was with Catholic Relief Services, which is one of the largest faith-based non-governmental organizations in the U.S. And this organization, we call it CRS, it had a huge amount of U.S. government funding to work with mission hospitals around the world to help them start HIV treatment for the first time. So my first international assignment was to Kenya. And we were using U.S. government money to start HIV treatment programs at mission hospitals, most of which were very remote. So 1 or 2 times a month, when I didn't have to be in the office, I would be up at 5:30 in the morning and fly from Nairobi, the capital, across the country to a tiny airport that was literally one room, and it had one runway right on the shore of Lake Victoria. We'd land and then we'd drive 4 hours on a really bumpy dirt road to the mission hospital that we were going to visit. And these roads were so bumpy that the seatbelts would rub holes in my clothes because they'd be rubbing against me for hours while we're bumping along. One of the mission hospitals was Seventh-day Adventist. The day we went there for one of the first times, the community had heard that HIV medicine was coming and 800 people showed up. So we arrive at this hospital and people are sitting and lying on the ground around the building. And, nobody was healthy. And I think we had enough funding for only maybe 80 people to start medicines. Like, this was right at the beginning. Here we had 800 people sitting there looking at us. Part of the first task we had was helping the hospital decide on criteria to triage who gets medicine first and who has to wait. There was a lot of ethical decisions to be made. And at the end of the week, we would speed back to that tiny airport by the lake, and we were always running late. Every meeting at the hospital would go over. And so we'd be driving on these bumpy roads back to the airport. But because the airport was so tiny, all the staff knew me by name. So they would see my name on the flight manifest, and they would hold the plane for me. This is actually a kind of cringeworthy, funny story, but we once had an official from Washington, D.C., from the U.S. Health and Human Services that was visiting to see, what's really happening with these HIV treatment programs. And so she was in the vehicle and we're rushing back, late for the plane. And as soon as the car pulls up to the airport staff came and got my luggage and walked me around the building and put me on the plane and shut the door. And the plane took off, and I left the woman from Health and Human Services at the airport. I can't believe we didn't lose our funding after that. We were able to get so many people on HIV medicine in such a short amount of time. 20% of all the people on HIV medicine in Kenya were at mission hospitals on treatment because of our project. And then there was other PEPFAR projects that supported the government hospitals and the military hospitals across the country so that we could make a huge impact very quickly to basically stop people from dying. It's really not that glamorous most of the time. I spend a lot of time in government meetings. I've spent hours and hours on very long car rides. I've constantly rewrote project descriptions and budgets over and over again to align with shifts in U.S. government priorities. It's a lot of time in the office and in meetings. But I think for me, the times that were most meaningful that are somehow hard to describe to people back home is when you get to go into the community and go into people's homes and sit with them and meet the people face to face who are benefiting from U.S. foreign aid. Zanzibar is an island of Tanzania, which is known for its beaches and resorts. And for me, working on HIV programming there, Zanzibar is now the memories of sitting on the floor with a woman as her child is dying. Or, Mount Kilimanjaro, which is, people go to climb. And for me, it's sitting in a town near the mountain, in visual sight of the mountain, but sitting with a blind grandmother and watching her grandchildren come home from school and hug her one by one as we're sitting there making a plan for, how to keep these children healthy, since some of them were living with HIV and the grandmother was blind and they had to figure out, how do we have enough money to raise these kids? Or, walking through trees of bananas with a widowed father and his toddler both of them living with HIV, or going to a school where there's been HIV prevention programming and dancing with the kids and giggling, or sitting with the women's groups who are saving money to support the healthcare of their families. You can't forget that. And they're just little pieces of bigger statistics, but you really see the impact. I've been lucky to have the ability to go back to my Peace Corps village in Zambia several times over the last 20 years. And I've seen people that started HIV treatment 20 years ago when I went to the St. Francis, the Catholic hospital, that are still living healthy with HIV now. And, they wave at me in the village and we smile. I think we share this secret that they've been on HIV medicine for 20 years and that they're living healthily and normal lives. And now the village clinic, that little tiny clinic that was near my village, also provides HIV services, testing and treatment. So people don't have to bike 2 hours to the Catholic hospital. They can get their services right in the community. One of the headman's grandsons, a boy who I've known since he was 6, he's now an adult working at the clinic as an HIV counselor, and he has basic lab technician training. That little girl, Saron, the little orphan, she never did go to school. She was married off as a teenager. At last time I saw her, she had 5 children, but her kids all go to school. And of course, they have 2 living parents. And people aren't dying now, which is huge, which you see as an economic impact. Because when I was there, you were just losing all your educated adults. I've seen a lot of economic impact beyond just foreign aid. Foreign aid has made sure that people aren't dying, but there's also now more solar panels available. People are building more brick houses and less mud. The World Bank invested in more clinic buildings, and now the government has put more clinic staff there, so there's more health services available. The elementary school was expanded. It now goes up to high school. There's been extension of electricity, so it doesn't reach my village yet, but it's nearby, and so there's a growing private sector. Like there's a butchery because there's electricity and people can have a fridge. We didn't have butcheries when I was there. If you wanted a chicken, you killed the chicken and you ate it right then and there. So, you're seeing the change and the evolution of this village, and people are better educated. But I feel like it all goes back to the fact that people are more healthy. If you don't have a healthy population, you're not going to have a healthy economy. And definitely without HIV medicine, this would be a very different story. In a country like Zambia, it was headed for economic crash because HIV was killing an entire generation of nurses, teachers, business people, politicians, people who worked in the mines, parents, and if the economy crashed, we don't live in a bubble. There's a global economy now, and this would have had global implications because it wasn't just Zambia. It was a lot of countries. And then ultimately, it would have set these countries way back and had an increased reliance on international aid in the long run. But also, I think we all know that infectious diseases don't respect borders. And so the work that we've done for HIV infrastructure now is used to address tuberculosis, COVID, Mpox, Ebola, all these things that can hop borders, that can get on an airplane and spread in a day from Zambia to the US, So it's important that we control this. It makes us safer, everyone safer around the world, especially those of us who like to travel. And then I think the last thing I like to tell people is that, these foreign aid programs that the U.S. supports, it's beyond HIV treatment. It's education, it's nutrition, governance, peace building. It's less than 1% of the budget. And that somebody did the math, and it comes to $36 per year per American, which seems like pretty good value for money for the return that you get. I know people give more than that to their church. So if for an extra $36 to make a much bigger impact that also helps the church do their health jobs around the world, that's a win.
Well, that means we're coming to the end of the episode, but I don't want to stop until I give Beth a chance to answer a question from our dubious Aunt Deb.
I give to my church. My church gives to charities. Isn't that enough?
I think my family appreciates that, I did have this meaningful career experience to work in public health and to show that Americans like us care about the well-being of people around the world. And I think they appreciate that Americans have a good reputation overseas, and this keeps everybody safer. I have cousins in the military, it's a complement of what the NGO and the foreign aid sector does with our military actions. Several people have asked me or asked my family members, why do we need U.S. foreign aid? Because we give to the church. So we are giving overseas, but we choose to do it through the church. I think it's important for people to know that it's very clear that it's both and not either or. Because churches play a very important role in healthcare around the world. There is no question. But I also know that the church cannot provide HIV services in a bubble. You have to have the national government running a health system of a country. The government decides what are the HIV medicines we're going to bring into this country. And, they need to buy the medicines and make sure they get out to the communities. The government runs the training facilities for doctors and nurses. They set the standard of HIV care in the country. They have a mandate to make sure everybody in the country gets access to HIV medicine. That's the responsibility of a government. And the church is a piece of that. A church plays a very big role, but it doesn't play the only role. People should be quite proud that U.S. foreign aid has been able to work with these governments and with the mission hospitals together and saved millions of lives. And we stopped an epidemic in its tracks. I hope that my relatives see the work that I do is worthwhile and understand. And I am welcome for people to ask me, because it's important for us to remember that, this is my tax dollars too. I want to see it spent in a good way. I don't want to see it wasted. And when I am put in charge of these programs, I hold myself accountable. I don't want to look someone in the face and be like, I didn't spend that properly. I have integrity. And I take that very seriously. We have a moral obligation, an economic obligation, and it doesn't cost us very much for the benefit that we get. And I think, it's just like when I go to my village and people come running out, they're happy to see me. Americans have a good reputation. We do good things. And I wouldn't say that every country is greeted that way around the world, but Americans are.
The U.S. government's decision to halt or sharply reduce USAID PEPFAR funding in Zambia, disrupting HIV treatment and malaria programs that had already reduced annual AIDS deaths from roughly 90,000 to about 16,000, has led to service interruptions. And modeling cited by the World Health Organization and UNAIDS warns that sustained disruptions in HIV and malaria services could result in tens of thousands of additional deaths in heavily affected countries like Zambia and contribute to millions of preventable deaths globally by 2030. Elizabeth Jere attended Johns Hopkins University and credits an internship in Baltimore and a semester abroad in Kenya for opening her eyes to public health work in action. Following her community health work in Zambia as a Peace Corps volunteer, she earned a Master's of Public Health degree, also at Johns Hopkins. For the following 2 decades, she lived in Kenya, Tanzania, and Zambia, working for the U.S. Agency for International Development, USAID, the Centers for Disease Control, and several American NGOs. At the time of the current administration's stop order halting assistance for work overseas, Beth was working as a global health writer for PACT. She also oversees Jiranileo, the first food tourism platform in Zambia. To learn more, check out jiranileo.com or check the show notes at softpowerfulstories.org. Thanks so much for listening. We always appreciate likes, reviews, follows, all that good stuff. And you can do that at our website. You can also find out more about the guests, look at pictures, and find ways to connect with us at softpowerfulstories.org. Thanks to my friend Kathy Zilski, who plays Dubious Aunt Deb, although she is nothing like Dubious Aunt Deb. My name is Christopher Wurst. I'm the host and creator of Soft Powerful Stories. Until next time.